Joseph. I'll be your nurse practitioner for today. What brings you here today? I have. What brings you today? Sore throat?
How long you have the sore throat?
2 days.
Okay. What brings the sore throat? Is it in the morning or afternoon?
Anytime.
Okay. On the scale of 1 to 10, how bad is your pain?
5.
Okay. Now, I'm going to ask you some questions. How many kids do you have?
2.
Okay. Now, do you have any health concern with your insurance?
No.
Do you smoke?
No.
Do you do drugs?
No.
Okay. Do you? I'm gonna open your mouth. I'm gonna check the mouth to see. Open your mouth. Open. 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 Ah. Say ah. 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 Do ah. Ah. No abnormalities. Think. Move your tongue from side to side. Okay. You can close now. Thank you.
I'm going to continue with the examination of the head. I'm going to look at the structure of the face, the hair, the eyebrow. We're going to make sure that the eye is in the same level. If they open, let me see, open the mouth. Check your eye. Okay. I'm gonna palpate the face to make sure there's nothing. You feel anything? Nothing. Okay. I'm gonna continue with the cranial nerve of the face. I'm going to access the nose for patency. This is the nose. Okay. Now I'm going to have you smell something for me. Tell me what it is. Coffee. Okay. Now I'm going to put something in your hand. You tell me what it tastes like. Salt. Okay. Now I'm going to do the vision again. I'm going to look at from here, look at this, and I'm going to go up, down, and here, and here. Okay. Clench your teeth for me, like grind. Okay. Can you on your forehead for me and smile. Smile for me. Now I'm going to examine the neck. Now observe the neck. And look at both sides. Now let me take my stethoscope to hear if there's any wood. In this case, I didn't hear any wood. Now I'm gonna do the part of the low auricular, maxillar, pericular, submaxillar, and mandibular, and then some clavicular. Mandible is right here, clavicular is here, superficial cervical, Now I'm gonna check the neck, the back of the neck. Now you're gonna swallow as I keep your head up and swallow. Okay. And exhale anything. Okay. I'm gonna ask you to raise your shoulder for me like this. Do your shoulder, look at me. You do your shoulder like this. Good. Okay. Let me check the ear. Good. Good. With the eye, I'm gonna look up into your eyes. Okay. Okay. Now with the Snelling chart over there, I'm gonna have you to stand up and say the first number for me. If you can see it. 8. Very good. And what about this one? 8. Very good. You can sit now. Now I'm gonna do that test for you for the ear. Tell me if you still hear it in both sides. You hear it in both sides? Yes. You hear it in both sides? Yes. Okay. You hear it on this side with the mastoid, I'm doing it. Okay. Now I'm going to push against your shoulder. Try to see if you can push it up for me. Oh. Okay. There you go. I'm going to check the abdomen for boots, anything. And I make sure I hear for 1 full minute. I didn't hear any abnormality. Now I'm going to percuss. And I'm going to palpate to see if there's anything. I didn't find anything. Okay, now front. Let me see if we can do that. Okay. Very good. We can stay. I'm going to check the palpate the lacrimal apparatus, and then I'm going to check the mouth. I'm going to check the mouth, the eye, open your mouth. B, lift up your tongue. Lift up your tongue. Okay, the teeth look normal. All mucosa moist. Okay, now I'm going to do the gag reflex. The okay. Everything looks normal. Now I'm going to do the cover and uncover test. The cover and uncover test. Put your hand like this in one eye. In one eye. Look straight. Okay. And do the other eye too. Put your hand like this. And look up straight. Okay. Very good. Now I'm going to palpate the trachea. I'm going to palpate the trachea. Okay. Now I'm going to examine the thyroid. I want you to swallow. Swallow for me. Okay. I'm going to go to your back. I'm going to ask you to swallow again. Swallow for me. Swallow. Okay. I'm going to take a look at your ear. I touch it, no lesions. no lesions to your ear, and I'm gonna take a look at it. I'm gonna take a look at it. Okay, it looks normal. Looks normal. Everything looks normal. Now I'm gonna check the chest for symmetry. If it's going the respiration. Respiration seems normal. I'm gonna listen to the lungs. No wheezes, no bronchi, no whales. No. Now, I'm gonna check for the Weber test. Tell me which side you hearing, left, right, or both sides.
Both sides.
Now, I'm gonna do another test, a Weber test. Tell me when you can't hear it anymore.
Can't hear it.
Also gonna do the lower extremity reflex. Good job, good reflex. Yeah, it jumps. I'm gonna jump on the pulses. Yeah, good pulse. Good pulses. Okay, I'm gonna check the reflexes. Jump. Yeah, jumps. Good reflexes. Good reflex. I'm gonna listen to the back of the lungs. No bronchi, no wheezes, no whales. Okay. Then I'm gonna check the back. Skin look normal. Looks normal. Symmetrical. I'm gonna ask you to see if you can bend for just for see if you can bend a little bit. Then I'm gonna focus. Go. I'm gonna inspect the abdomen. Abdomen look normal. Skin warm. It seems symmetry, round. I'm gonna listen for a full minute to the bowel sound. Now I'm gonna focus for the liver. Let me know while I'm doing the palpation if it hurts. Any pain?
No.
Tenderness?
No.
Okay, thank you for the examination.